Hemophilia 101 by Ari Foster
and Ben Sendo.
What is hemophilia? Hemophilia is a rare blood disorder where the body is lacking or completely missing a clotting factor, which causes cuts, bruises, and internal injuries to bleed longer, but not necessarily in larger amounts.
There are three types of hemophilia: hemophilia A, hemophilia B, and hemophilia C.
The first type of hemophilia is type A. 80% of hemophiliacs have type A. That's 25,000 in the United States alone. 30% of reported cases were spontaneous gene mutations. Hemophiliacs with type A are lacking factor VIII. 1 in 5,000 male births have hemophilia A.
Next up is hemophilia B. It was called the Christmas disease when it was first discovered, and 20% of all hemophiliacs have this type. That is 3,300 in the U.S. They lack factor IX, and hemophilia B happens in 1 in 25,000 male births.
The third type of hemophilia is type C. Hemophiliacs with type C are lacking factor XI. Type C is the rarest type, being 10 times rarer than type A. Symptoms for type C are often mild, and frequency of bleeding is not determined by factor level nor severity. Type C is not linked to the X chromosome, meaning it can affect both males and females equally. Type C is not commonly associated with bleeding in the joints and muscles, unlike type A and B.
There are different levels of severity when it comes to clotting factors. The first is somebody without hemophilia, who has a normal level of clotting factor at 50 to 150%. Next is mild, which is 6 to 49%. Then is moderate, which is 1 to 5%. And lastly, severe, which is less than 1%. And 60% of hemophiliacs on average have that.
The two biggest health concerns with hemophilia are head trauma and bleeding into the joints. Head trauma is bleeding of the brain inside the skull, and if not treated, it can easily cause death. Injection of coagulation factor is necessary for head trauma, and therapy may be needed to help recover. Bleeding joints is bleeding caused by joint damage, most common in severe hemophiliacs. Possible signs would be tingling in the joints, stiffness, warm skin, swelling, and pain in the joints. Follow RICE when there is a joint bleed. RICE is rest, ice, compression, and elevation.
There are two different treatment options when it comes to somebody with hemophilia. First off, there are plasma-derived products made from human blood. Secondly, the recombinant products, which are recombinations of DNA.